Oh, good question. I do believe that we are in charge of a very powerful diagnostic tool. I think the fact that you see live 3D and 2D images of the heart, whilst you have a clinical question or a clinical diagnosis to answer for. And unlike other tests where you do the test, wait for the result the next day, you're actually seeing the result live, which makes you sometimes modify your protocol and how you go about on the test. It also makes you think whilst you do the test, considering the findings you see during the scan. Adding that to the complexity of the heart, I think that makes it very challenging and interesting. Yeah. I think flexibility needs to be on the top of the benefit list. The fact that you move around quite a lot gives you quite good resilience, and you tend to adapt to different departments, and also as you work with different people and different consultants, you'll learn different ways of look at clinical questions and clinical ways of doing things, and which also helps you in your personal development. I always think that for someone to be a locum, they sort of need to be independent in whatever their field is. If that's not the case, the main advice I would give is just for them to be honest, just with their employer, with their recruiter, and tell them what are their limitations. I think the main point is don't do anything that's out of your comfort area, because that's where mistakes usually happen. And also don't be afraid to give your input, because as a locum you probably would have worked in different places, and different places might have different ways to do things, and you can give that input to the place you work at and improve the service. The fact that you have a patient that has a certain problem, and you can help to not fix that problem, but you can help with that question, with that problem, and by doing something stimulating, and that hopefully it will lead to their recovery, is the most rewarding thing of them all. Yeah.